So can you ever be too far gone to get cosmetic dentistry or just really bad gums, bad teeth, where you're limited on what you can do?
Well, that's probably one of the most amazing things about dentistry today. And I've been around dentistry long enough to see a lot of things come and go. But the beauty of it is today we have so many options. So there's an option for every person out there. I mean, some people say, well, I don't think I need dental implants to do this. Well, there's other options. I mean, we can do a full mouth reconstruction. And sometimes we'll use implants in specific locations. Sometimes we'll have to replace all the teeth with dental implants. Or sometimes we might not have any dental implants. We might not have to extract teeth. We can whiten teeth. We can do veneers or crowns or whatever the situation calls for. So, and I tell patients all the time, we can, for some people, they want to start in one place and get a better smile, but we can always do something more for some of these people. So it's one of those things where I always start with the end in mind. So whatever it takes to get to that end result that the patient is looking for, that's what we do.
Now, from doing this show for the last 20 years, and I've interviewed thousands of doctors, I think what I've learned is that, or at least what dentists have told me, is the public thinks, including me, that all dentists have the same training. But I guess to do this so-called full mouth reconstruction, there's after dental school, you have to go to a lot of training to understand this. Right. Is that right? So how do you find it? I mean, how do you know if your dentist is equipped to handle the full mouth, as you call it, full mouth reconstruction?
Well, I think those are questions you have to ask. And what I always tell people is come in and we offer a free consultation, 3D scan, and we can give you options and talk to you about and tell you about our experience, and I can actually show you before and after cases. So my advice: have them show you the before and after cases of their cases they've done.
So if they have very few before and afters, be suspect?
Well, if they have very few before and afters, or they're somebody else's before and afters, then you probably want to question them a little bit further.
Because I've looked at some of your before, and I'm not trying to side with you, but I've looked at some of your cases. I mean, they come in like their mouth is a complete disaster,
right? And
then they end up with this beautiful teeth.
And that's what gets me up and out of the bed in the morning and gets me to work, because I know sometimes I almost feel bad because I'm sitting there kind of smiling, thinking, wow, this person has no idea how good they're going to look when they're done, and it's because of all the things we have available to us today, all the solutions that we have for permanent solutions.